Welcome back to Her Birth, Her Story, where we share real birth experiences. I'm Brick, your host, and today I am so excited because we are sitting down with a pelvic floor occupational therapist named Stacey. She has her own practice, and we really dive into the questions that all moms are wondering. We get to dive into a couple of her birth stories so that we can really hear the heart behind her practice, and we even get to bust down some myths that go hand in hand with pelvic floor therapy. And just in case you didn't know, Kegels do not fix everything. We really dive into why pelvic floor therapy might be a good thing for my C-section moms out there, and leaking after a baby, is it normal? We really dive into why autonomy matters and why empowering women and advocating for yourself is crucial in all realms of life, but especially in birth and postpartum. So we're gonna hold space for Stacey and her story. Hey Stacey, thank you so much for coming on Her Birth, Her Story. Can you go ahead and just start by introducing yourself, maybe your credentials, and a little bit about your practice?
Sure. So thank you, Brooke, for having me. I'm so excited to be on here. So again, I'm Stacey. I am an occupational therapist. I am also a certified perinatal health specialist and pelvic floor therapist. I co-own a practice up here in Ohio. It is called Wildflower Wellness Therapy Services. So we look at like the family as a whole. We treat moms, we treat postpartum, we treat babies, kids, everything you can think of. That's what I do.
That's great. For listeners who don't really know the importance of, a pelvic floor occupational therapist, can you kind of speak to what that is?
Absolutely. So when you think of pelvic floor therapy, you're like, what are we talking about here? The pelvis, the butt, the legs, whatever it might be. As an occupational therapist, I look at everything we do every day to take care of ourselves. So things we do every day are go to the bathroom, have sex, all the fun things that we do.
Yep.
And that is what I focus on. So we look at everything that has to do with the body, and it starts from our head to our toes. Typically, if there's something dysregulated in the pelvic floor, whether it be including our nervous system, whether it is an incontinence episode, we have pelvic pain, there's usually an underlying root cause that is causing that. And that's what I look to find out to help treat people. So I am an occupational therapist. A lot of people think of pelvic floor therapy and they think of physical therapy. So PTs and OTs, we both treat in that same realm. We just have different lenses. As an OT, I look a lot at the body as a whole and through a mental health lens. So occupational therapists, we have a big background in mental health. And when I am treating a patient, I put on my trauma-informed cap that we wear to really know what we're getting into with that patient. So every one of my patients is treated differently. In pelvic floor therapy, you can treat literally from womb to like 90 plus years old. I have had patients that have been pediatric patients, and I have had patients that have been older than my grandma. So
Wow.
that's kind of what I work on.
Yeah, that's awesome. And so why is it important for us, especially as moms or people who just walked through birth, why is it important for us to really look into pelvic floor therapy?
Sure, that's such a great question. In my opinion, because it's what I do,
Yeah.
I think every woman, specifically birth or not, should have this. There are different parts in our life that we might get dysregulated, like I said before, to where we need to kind of get our body back in sync. So specifically after birth, you have this beautiful little baby, we birth a beautiful little baby either via C-section, vaginally, there might have been complications. We're handed our baby in the hospital for the most part. And we're told, here you go. Good luck. Go home. If you pee your pants, it's normal and it's okay. And you know what? Just Kegel. That's all you got to do to be healthy. When in fact, that is not what you want to do to be healthy and get everything working again. So in this realm, pelvic floor therapy is super important. We look at everything about the body, like I said. So I'm looking at our belly muscles. How are our belly muscles working? I'm looking at our GI tract. How are we going to the bathroom? I'm looking at any incontinence or pain that's going on. mental health awareness with it. And then just as an occupational therapist, we also look at our routines and habits. Pregnancy, right? We get pregnant, boom, crazy change in our routine. You know, you're sick, you're happy, you don't even know you're pregnant, all the things.
Yeah.
And then we have this baby, boom, change in a routine. We get our routine down, boom, some moms are right back to work and we forget to fix ourselves. I think postpartum, I'm actually 7 months postpartum, I think today. So I have a almost 7-year-old and a 7-month-old. So
awesome.
Big age gap there, and a woman who needed pelvic floor therapy and decided to change my whole career towards that. It is huge. It is something that every woman should have, and it's really a disservice in our country that it's not an automatic thing that's prescribed to people.
Yeah, no, I agree 100% with that, especially because when you look at the physiology of birth, anyways, and you see how much the pelvic floor is truly involved when it comes to pregnancy and birth and postpartum, I don't understand why it's not something that is just part of routine care. Before we jump into your story about how you really changed your career to pursue this. Can you speak really quick to, it can just be like a vague overview, but just the difference between like the OT side and the PT side of just like how it's different?
Sure. So I'll go back to like my training. I've done all the trainings there are. I have all the certifications that you can kind of get. And when we're looking at a physical versus an occupational therapist, we have the same knowledge. So the differences where it lies into is in our education and our schooling. So I'm not a physical therapist, so I am just going to go from my observations. I have wonderful friends that are PTs and work in this field, and they're incredible. I learned from them as well. They have a beautiful, beautiful background in orthopedics. With a partner I used to work with, she is a physical therapist. She taught me so much about the ortho component to everything, how our bones are, how our ligaments, how everything is affected, right? I know that from my training too, but that is such a good focus. Where from the OT perspective, I have that, but I also look at that person as a whole. So I'm looking at you. You just had a baby. Great. What else do you do? Oh, you were a runner. Oh, you have 5 children at home. You live in an apartment that has 17 steps you have to walk up. I'm looking at that whole thing, kind of developing a picture so we can treat you for where you need to be and what you want to do and get you back to your life. In physical therapists, they do similar. We just look at it differently. So I'm looking at you as that whole person and not just treating the symptoms. So if you would come to me and you're like, Stacey, oh my goodness, I'm coughing and sneezing and peeing my pants, because that's like the common thing I hear, right?
Yeah.
I'm not just in treating your incontinence and great job, we'll see you later. It's okay, well, how is this affecting you socially? Are you seeing your friends? No, because every time I laugh, I pee myself. Great, we need to fix this so we can really turn you back to being able to do things that you find meaningful. So as OTs, we look at meaningful occupations. Occupations are everything we do. So being a mom, that's one of our roles. Working, a stay-at-home mom, the hardest mom there is, a stay-at-home mom, we know that. Being able to do everything we do every day and be able to be in the moment without having to worry about how is this going to affect us. So that's kind of like how we look at it a little bit different. We do have a similar lens when it comes to the pelvic floor, but it's just we treat different. And there's some OTs that treat like PTs and vice versa. And it's one of those things that's really nice because this is such a good field that we can all work together in.
Yeah, no, I love that. And honestly, especially with being postpartum, I definitely feel like how you approach it of just, not just going for the symptoms, but just like the whole person is probably so valuable for women, especially in that postpartum, because postpartum can be rough. So,
oh yeah, I'm in it, girl. And you think about just the hormones, right? So women that are pumping, breastfeeding, years upon years, you're still in postpartum. You're still working on that postpartum. You're still trying to, you have those hormones rushing through you, which can affect us so much in our whole body.
You had mentioned to me too, just about how your own personal birth story really just kind of made you change your career to servicing women like this. So can you kind of just walk us into your birth story?
Sure. So I have 2 babies. I've had 3 pregnancies, 2 babies. And my first baby, like I said, she'll be 7 in May. She's like my little pre-pandemic cute little baby. Her name's Reagan. So I got pregnant with her when I was 29. and had a pretty rough pregnancy in the sense of how my mental health was. I was super anxious. I worked in a pediatric hospital at the time, so I knew too much.
Yeah.
I worked oncology in the burn unit at that hospital, and I saw all the bad things.
Yeah.
And when during the pregnancy, like my pregnancy was fine, if that makes sense. Like I was okay. It was my anxiety was so bad and debilitating. It really affected me. It affected her growth. So she had in uterine growth restriction. She was only 6 pounds when she was born. And I always was waiting for something else, like the hat to drop. And I've never prior to that had this bad of anxiety. So fast forward to that part, and May came along. I went to my 39-week appointment. I was feeling kind of yucky. They took my blood pressure. It was elevated, and they're like, hey, your blood pressure is 140 over 50. We're going to send you to triage so we can make sure nothing, no preeclampsia and stuff. And I was like, okay. I started swelling, so I was like, oh, I'm probably going preeclamptic. Okay, we're going to be fine. I go home instead of going to the hospital because I was like, I got to say goodbye to my dogs, Got to make sure they're going to have a sister when we get back. Went, took a shower, changed into, I had scrubs on. I came from work to my appointment. Went and took a shower. My doctor called me. She's like, where are you? And I'm like, oh, I'll be up there. She's like, you need to get up here now because your blood pressure. I'm like, okay, fine. Go up there. They take my blood pressure. It's still a little high. It's in the low 140s over 50s, and I was like, over 80, and I might have said 50 earlier, but not that low. And they took it, and it was still a little high. They're like, I think we're going to start induction. You're 39 weeks, blah, 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 blah. And I'm like, I don't want to be induced. Is this something we can monitor the next couple days? And they told me, oh, we really highly recommend. I'm like, well, why are you recommending? Can you explain it to me? Because I also, at this point, I had been working as an occupational therapist in the hospital systems. I'm not a physician or a nurse. So I was like, please explain this. I get it, but I don't understand why you're making me do this. And they scared me into doing an induction, essentially. After they told me I was staying, my blood pressure was completely normal. I did all the lab testing. I had no protein in my urine, no signs of the preeclampsia. They're like, you don't have it, but you're here, so let's do a baby. And I'm like, okay, naive, ever having a baby. And so they started me on, I think it's called Cytotec. So sorry for all my nurses out there if I say the wrong stuff. Started me on the Cytotec or whatever the little pill is they put, and that didn't work. So they did a second round. When that didn't work, they used a Foley bulb, which I don't know if you know what a Foley bulb is, but to anyone out there, for me, I will say I have friends that have had one. It was totally fine. They did not provide me any pain medication or anything. So I had a Foley bulb in for, I think it was 11 hours. It's this little balloon that they blow up to make your cervix mechanically go to about 5 centimeters, I believe. And it was the most pain I've ever felt in my life. I went from no contractions to literally the worst pain I've ever felt for 9 hours straight. And no epidural, no nothing. I didn't know I had the option of doing that. So again, no options. So by the time that came out, mucus plug came out, everything went with it. At this point, I'd been at the hospital 24 hours, and then they were telling me, we're going to break your water because we need to progress this. I'm like, okay. Baby was doing fine. I was a little stressed out. My blood pressure was low at that point just because I think I was exhausted. They ended up breaking my water. 18 hours later, baby wasn't progressing because, again, they pushed me into, the induction. So at that point, I think by the end of it, I was 44 hours in, and they're like, hey, at this time, they're like, we got to do a C-section. And I said, why didn't we just do a C-section when I asked you to do it? Because literally there was no movement. My baby was sitting high. I mean, my cervix did not open by itself. It was so defeating. Went into my C-section. Anyone that has experienced a surgical birth, I'm not discounting any vaginal births because I personally have not experienced it. And I know there's rough things during vaginal births as well. They strap you down, at least me. They gave me the medicine. I'm shaking like crazy, strap me down, blood pressure's through the roof, do the surgery. Baby's delivered. She's crying. I couldn't even hold her because I was shaking. They put her to my face. My husband got to hold her. I was just laying there thinking my whole birth plan, right? They want you to make a birth plan, which I'm not opposed to birth plans, but I'm going to tell you something. When I think of a birth plan, this is what I think of. Boom. Because that's exactly what happened to me. I have had friends who've had beautiful births. So again, I'm not discounting anyone else, but I have this beautiful baby. We go back to the room. I can't walk because I'm numb, obviously from the epidural. I ended up having an epidural at the very end. I had to, a spinal block. Otherwise I was going to be intubated. So went back, thought, This was traumatic. I think all birth can be a form of trauma, whether it was beautiful or not. It's trauma to your body. So your body has that muscle memory. I was at the hospital. I think we were there for 5 days straight just because I ended up like, they had to give me blood and like the whole thing. I had low iron, like just, just not a good experience.
Yeah.
I felt like I didn't have autonomy. I felt like no one heard me. I had my first baby at a huge hospital system and they treated me like a number. There was 40 other births plus that day, I'm pretty sure.
Wow.
And I used to work at the hospital that I had my baby at, not at that time, but it was really disheartening. I went home with this cute little nugget, love being a mommy. Around 9 months, I would say like 6 to 9 months postpartum, your body goes through a humongous hormonal shift again. My husband, this was right before the pandemic happened, and my husband got a job in Indiana. So we were living in Ohio, and he used to coach college football. So for us, it was like, all right, where are we moving to? And we decided to take that job offer. It was a great offer, great, good experience, whatever. So we took that, and he left. And 2 weeks later, the pandemic happened. My daughter, I think, was 7 to 8 months around that time, 7, 8, 9 months old. Pandemic happened, licensing boards shut down, so I couldn't even get my OT license to work in Indiana. So my husband couldn't give up his job because we needed to pay for our life as well. So we lived apart for over a year, and it was seriously the hardest thing ever.
Wow.
So when I think about my birth story, the postpartum's my biggest part of my birth story.
Yeah.
Whenever I was postpartum with my first, I was a machine. I would wake up, baby go to daycare, work, come home, go to bed, wake up. That's all I did. I was just me. My family was close by, but they're also, my mom works full time. She's the most amazing mom, but like I can't rely on anyone to help me. So,
Yeah.
and I can rely. I shouldn't say that in that way, but at that time I believed I couldn't rely. I used to have a lot of, again, anxiety
Yeah.
dealing with, I never showed anyone how I really truly felt. My birth experience, I feel my first one was very like I got robbed and I feel like that's still now why I do what I do now. So I took that experience. I went through the perinatal anxiety, got diagnosed with postpartum anxiety, really like OCD level, where I was having OCD tendencies. So when we talk and when I educate women, there's so many perinatal mental health disorders that can happen after having a baby. And you might not even realize it. I didn't realize how OCD I was. Like, I was so scared to like do anything where I would count like crazy. I'd be like, okay, it's 12 steps to here. It was this until someone pointed out, Stacey, what is going on? I'm like, I don't know. I have to count like it was so bad.
Yeah.
And then my husband, a year later, we were able to move to Indiana. So when we moved to Indiana, I didn't realize how bad it had gotten until I was living with my husband again. And he's like, why are you like just the things that were happening? So I decided to finally get help, which was fantastic.
Yeah.
I was able to start some medication to help my anxiety. And I am a huge proponent of doing whatever makes you feel good and normal and therapy. I was able to work through a lot of things with my therapist and with my anxiety medication to where we were able to have another baby, which was great. So we have a huge age gap, number one, because we didn't live with family. We were out in a different state and there was no way in heck in a good spot to be able to have another baby. But also we had a miscarriage in between, which was really disheartening. I got really sick when we lived in Indiana, like a bunch of sicknesses at once, and it caused my immune system to really like be corrupted, which women, I'm going to tell you right now, you get in your 30s, your immune system likes to mess up on you. And sometimes those autoimmune disorders will come out, which my family, we are not an autoimmune disorder family, but I have one, which is really frustrating now. To where it affected me. And I was taking steroids again, topical steroids. It really put havoc on my immune system, which was terrible. So when we moved back to Ohio, it was like 2 years of healing my body. When I finally got pregnant, so with my first, it was our first try, we got pregnant, which is awesome. When I got pregnant with this baby, it was again first try. And right in between my babies, I ended up having a miscarriage, which was terrible. Obviously, if you go through any kind of loss, whether it's that feeling of you're like, my body can do this again. This is exact. Oh my gosh, right? Yeah. This is amazing. We had Reagan. Miscarriage was in between after about 2 years of like really healing my body. I worked with a functional health coach. She helped me get on like really good supplements to help kind of heal my body. Weight loss was occurring. I was back to working out. Bam, got pregnant. I was like, this is so exciting. We're here, we're here. And I was at work the one day. Again, I was talking to my coworkers who both just told me they were pregnant. We were like, oh my gosh, all of us are pregnant at the same time. This is exciting. And I went to the bathroom the next day. Went to the bathroom and I'm like, ooh, I feel crampy. Oh no, I know what's going to happen. And I ended up miscarrying while I was working. And I think something to talk about as well is miscarriage is not a small thing. I think whether it is you get pregnant and don't even know because it affects your body so much versus you have a baby and things happen. Like, there's so much, I mean, different levels of how we feel. But going through that, especially I had to go back to work and work with patients and I'm bleeding profusely, to lack of better words, was the most horrible thing. And I think of how I just had to pretend I was okay all day, and that wasn't fair. Also, talking with my husband, wonderful man, love him, but of course it was hard for him too. But I think sometimes it's hard for our spouses because they aren't the ones experiencing it like physically, but my husband was also experiencing it in a different way.
Yeah.
But where it took me a long time to get over, he was just like, all right, Stacey, we got to move forward. We gotta keep pushing, and not in a bad way, but like he's a very glass like full person and I'm a glass half empty. And he always tells me, he's like, you need to fill your glass. I'm like, I can't, because I'm thinking of all the ways this can go wrong, which is a fault of my own. But it took me a while to get over that. And I got obsessive with tracking everything I was tracking, like all those silly apps there are out there, everything you can think of. And then one day, I think it was, let's see, when did I have her? 2024. That like November, I looked at, or October, I was like, I'm done. We have one beautiful girl. We're good. Like, we have a great life, whatever. We took her to go see her first movie at Moana. I fell asleep in the movie theater and I'm like, what is wrong with me? Pregnant, because I didn't care anymore.
Yeah.
And I was like, oh my gosh, I'm 36 and pregnant. What are at that time 35? I'm like, what is life right now, you know? And that's what led me into our second baby, which was a completely different pregnancy, a completely different experience. So I went from my first baby where I had lived with such bad anxiety that I didn't get to enjoy any little moments because all I could focus on what was the next task I had to get done to make sure we made it through the day, because it was just my daughter and I. And then with Georgia, she's my little chunky butt baby. She was my almost 9-pounder because I was so happy during pregnancy that I just, you know, it really shows how, like, people always say like babies are all different. They sure are. But it always shows like mental health in pregnancy, how can truly be affected. With Georgia, when I got pregnant, I like cried. I had so much emotion. I treated my anxiety throughout pregnancy and I had such a lovely pregnancy, and the most, like, I just was like, okay, because at the end of the day, I had such a traumatic first pregnancy with having so many tests. They put me through all these tests. Something else to mention. So for any healthcare providers out there, we're in charge of care for women in this regard in pregnancy. Like, I know there's like stipulations and things you have to follow, but also understanding when you have someone who's overweight. So me being overweight during pregnancy, I had extra monitoring, which is kind of nice, you know, but also understanding just because you are overweight doesn't mean you need to get echocardiograms and everything else, because that someone with anxiety, like, it makes it worse. So again, not a physician, but those were things like my first pregnancy. I'm like, okay, I gained 12 to 15 pounds this whole pregnancy. Like, what are we doing here? And then there's the next girl that's gained 80. My whole first pregnancy was like, I wouldn't eat because I was so focused on not weight gaining. Where this second pregnancy, I didn't eat like crazy, but I didn't limit myself. I was like, oh, I can have 12, I can have a handful of almonds. I don't have to count out 15, whatever the serving size is. So I think that is a huge thing people don't talk about, especially like whether you're overweight like me or not, like curvy or whatever you want to call it. We all have our things that we're like, oh, we don't want this to happen when we have this baby. So with my second pregnancy, good pregnancy until I hit about I was 28 weeks pregnant and I woke up in excruciating pain. 2 days before, I kept getting really bad indigestion, and I'm like, this stinks. I never get heartburn, nothing like that. So I woke up and stood up and I thought I tore my round ligament. So like, if you know what the round ligaments are those ligaments that kind of hold the belly. And it felt like my right side, I tore it, and I was having contractions, and I'm like, my gosh, this is not my plan. We've had such a good pregnancy, right?
Wow.
So I got up, I was crying. I'm pretty good at tolerating pain. And my husband heard me crying. He's like, "What's wrong?" I was like, "I think I tore my round ligament. I'm hurting so bad." And he's like, "Okay." So my husband takes me to triage. I know the whole nursing staff. Something I didn't even mention what I did. I just quit my full time job and I'm doing my company full time now. But my full time job, I used to work with our local birthing unit at the hospital, and I worked with every mom after C section. So that was what, after my experience, I created. And so all the nurses I worked with during this time knew me very personally, and they're like, "Why are you here? Like, what's wrong?" I was like, "I am having the worst pain of my life." The doctor comes in and he's like, "Stace, I don't like, what's happening?" And I'm like, "I don't know. Tell me, like, what's going on?" And he like poked my stomach. He's like, "Do you hurt here?" And I'm like, "Yes." He's like, "You have acute appendicitis." So,
Wow.
PSA for all the women out there, women in general, because of working in medicine and all of that, we don't care about our symptoms. We're just like, we'll get over it. It's okay. It's fine. Like, we're going to be fine. I had been experiencing the common signs of appendicitis, thinking, "Oh, I have round ligament pain and indigestion," when in turn, my appendix had ruptured and I was becoming septic. So, yeah, I was like, this has been such a good pregnancy. The whole time I'm like, well, we got to do what we got to do. The worst pain I've ever been in my life. They ended up doing an echo, I think an echocardiogram, I had an MRI, like all the things, and they saw my appendix had ruptured. So I was emergent. They were going to life flight me to OSU Medical Center because we live in a smaller community at a smaller hospital. They ended up getting an ambulance. I was rushed to OSU Medical Center where I received like amazing care in their antepartum unit. They got me into surgery. My infection was so bad that I had to be on antibiotics for like months, which was terrible. My antibiotics made me even more sick, so I had to be on more antibiotics. But essentially, whenever I was there with the surgeon, she sat down, she's like, "This is an emergency situation. We have to get you into surgery right away. You need to make a decision what we need to do if we have to have a C-section." And I was like, "What do you mean?" And she's like, "You might have to have a baby today."
Yeah.
So I'm like, "What do you mean? I'm only 28 weeks. This is going to be a NICU baby." Like, I'm like, this is not my plan. Again, where's my scrap paper? But
Yeah.
again, like, I'm like, okay, well, then we got to do what we got to do. They're like, "We're scared we're going to lose you and the baby," because my infection had gotten so bad. So they get me prepped for surgery. I go into the ER. There are two sets of doctors because the one doctor's shifting off as the other one's shifting on, but it was a whole set of, they ended up all staying because one was a set for my baby.
Yep.
And one was a set for my appendix. Georgia ended up being on my left side the entire time. So when I went under, they're like, "You might meet your baby girl. It's going to be okay. We have a great NICU." And I was like, so prepared for all this. I feel like if anyone's ever had surgery, you feel like you fall asleep and wake right up. I woke up and I'm like looking around. I'm like, what's going on here? My belly still felt big. And I was like, oh, I wonder, like, I was like, "Do I still have my baby?" And the nurse is like, "Yeah." I'm like, "They said they were taking my baby out." She's like, no, they were able to keep her in. She stayed on the left side the whole time.
Wow.
So the best part about all of this, again, a trauma to our body, right, is that I was able to carry her to almost 38 weeks, which was fantastic.
Yeah.
I wasn't expecting that because of my surgery. And this poor baby had so many antibiotics prior to her being born. I don't even know if she can take antibiotics now in her
Yeah.
life. But I ended up having a repeat C-section. I'm a huge advocate of VBACs. If you know what a VBAC is, I'm sure you do. For me, just not a good candidate. I had a surgery 2 months prior, and there was no way in the span of 3 months, like trying to have a VBAC with an abdominal surgery.
Yeah.
No way.
Yep.
So I ended up having my C-section with her, and we ended up having her a little bit early because my blood pressure again went up, and that time it was a little bit higher. I had labs and stuff done. They marked me like preeclampsia, but I didn't have like the positive markers in my labs. It was just the blood pressure. And again, smaller hospital, which she was already almost 9 pounds. So I was just like, yeah, that's fine, whatever. And then whenever we talked to the doctor, he's like, she actually probably was a week ahead. Because with my measurements and with their measurements, I was like, there's no way she's this young, because it didn't work out with my timeline. So we ended up having Georgia. Developmentally, she was great. Second C-section, completely different story when you get to plan it. She was early, but still having a planned C-section to where I knew what to expect. I didn't have the shakes. The only thing that happened when I had that dreaded surgery is I was awake when they put my spinal in, And whenever I laid down, my blood pressure went down to like 50 over 30.
Oh,
So they were confused. They were scared because I went like, whew, like a huge flip.
yeah.
So they were monitoring me. I remember I kept saying, I'm just relaxing. That's all I kept saying. And my husband's like, we were scared because my blood pressure tanked.
Yeah.
But other than that, everything else with that part of my birth, with my second, went okay. I just had the trauma at the end. My body was just like, hey, listen, we're going to rupture your appendix and you're going to deal with it. And I was like, okay, I'll get an extra month off work to sit around and not be able to walk. I guess that's
Yeah.
where we're at with things.
Yeah. That's amazing though that they were able to do that surgery and still like allow you to carry your baby. That
Yeah.
they didn't have to take the baby as well. Like that's wild.
Usually, typically with appendix surgeries, they can do a pretty good job with having the surgeries around the 28-week mark, though. That's at least what I was told. They told me that's typically when they'll deliver.
Yeah.
So I was fully waiting to have a little baby NICU baby. She was weighing almost 4 pounds then. So I was happy in that regard because in my head, I know the viability and like what the ages are and things.
Yeah.
But it was so ironic because of where I was working in a birthing unit. And I'm like, I'm literally the person like that helps these people and I'm not even prepared to do this right now.
Yeah.
So with my birth stories, how my long, beautiful birth stories, how that so molded me into what I'm doing now is especially my first, I looked at that. And at the time I had my master's in occupational therapy. And I was like, what can we do as therapists to be better? Why are we not working in this realm? And then I went back and got my clinical professional doctorate at Indiana University. And I was like, I'm going to get a doctorate. We're going to do some research. So that's what I did. Doctorate research and was like, I'm flipping my whole career. And since then, so it's been about 4 or 5 years now, I've been in this realm with working with women. Within the last 2 or 3 years, that's when I really honed in on pelvic floor therapy. So when I started out with women's health, it definitely had the mental health aspect to it. I still focus on the mental health aspect in the sense of like, how do we look at our routines? How do we look at how we're doing things to be able to be successful throughout the day with our babies? Another huge thing we look at are co-occupations. A co-occupation would be like a mom and baby. Think of breastfeeding or bottle feeding or any kind of feeding. That occupation that we're doing those things together. How do we do this in our new normal routine when our whole routine has been disrupted? So whenever I ended up going through all the things I went through, I was like, there's just got to be more, like I said. And that's where I got into this field. I love women's health. So I work primarily, my caseload is pregnancy, postpartum, prior to pregnancy, like prepping for pregnancy, endometriosis, any of those kind of tough diagnoses that are going on. I work with women. I am viscerally, excuse me, and manual therapy trained as well. So a lot of the times therapists will work on our organs. So like we're able to do different techniques that we learn to work through scar tissue, which is huge. One other thing with C-sections, my scar healed beautifully on the outside, but underneath we can sometimes have adhesions that can really affect getting pregnant. When I was little, I don't know if you can see it on here, but I have a huge scar on my arm right here. So it's right on my elbow joint. If I couldn't move that and I was restricted, that's going to affect everything we do every day. I have beautiful range of motion. It doesn't affect me. Same with the C-section scar. Same with appendectomy scars. Same with gallbladder scars, abdominal scars. If you have scars there, it can pull everything that's above and below and really affect our range of motion. So think of our uterus, our bladder, everything that's in that area, our rectal tube, like anything that's in there. It could be pulling and affecting those organs, affecting those tissues down there. So I loved learning about that. I'm like, this is what I'm doing for my career. I'm changing it. I'm doing it all. I love it so much. So that turned into me working for my last job where I started the whole postpartum program for occupational therapy. And I just recently, like I said, I left a great hospital, just decided I really wanted to focus on what I love.
Yeah.
And now we're running it, which is fantastic. So my business partners and I, we all have different beautiful like specialties that we focus on. Definitely family oriented, but I focus again, postpartum. I do have some clients that are older as well, and not old by any means, but like not in pregnancy. And I have clients that are younger that are not pregnant, but that seems to just be who navigate or gravitates towards me because that's like my passion.
Yeah. No, that's awesome. And you have kind of described your work to as nervous system informed. What does that actually mean in like real life for a pregnant or postpartum mom?
Yeah, beautiful, beautiful question. So, if we cannot regulate our nervous system, so again, this is a beautiful example. My first pregnancy, nervous wreck. I couldn't eat, I couldn't sleep, I was living like up here. So that really prefaced like how my body responded to my birth and my experiences, and I couldn't calm my body. Once was able to understand what I can do to calm myself, so diaphragmatic breathing, so being able to breathe through it, mentally working on stuff with my therapist, grounding is huge. So I always tell people there's a couple of things you can do to really calm yourself in a quick bind. One is laying on your back, legs on the wall. So you were like this on the wall, legs here, back, and breathing. It just helps calm us. Another one, something we all do and we don't know it until someone points it out. Do you ever just sit there and go, that? Those are ways that we calm our body without knowing it. Wow. So when we do this movement, like as silly as that looks, that kind of stimulates our vagus nerve and calms our body. When we lay down and really focus intentionally on breathing, we're regulating our nervous system to prep us for that next step of what's going on.
Yeah.
So when I have a client and you're my client, Brooke, and you're sitting with me and you're coming to see me with some things that are going on, the first thing I'm not going to do is be like, okay, you're going to get undressed. We're going to do a pelvic exam. The first thing I'm going to do is introduce myself and explain what I'm here to do to help you and give you options. So I think a huge thing is when we're regulating a nervous system, when we don't know what to expect, like you go into something and you're kind of anxious, we got to calm it down.
Yeah.
There's some women I've worked with, I couldn't even work on anything externally or internally because we had to work on their breathing. So it's meeting that client where they're at, that person where they're at, to really calm so we can proceed with whatever they need.
Yeah, no, that's really good. And I like too how because I'm a very big advocate for informed consent. Informed consent and education are the two things for me that I think is so valuable. So I love that you don't just jump right into things. You are truly establishing that relationship and informing them like, hey, this is what we're going to do, but this is why. Here are your options.
Yes.
They have the option to obviously say yay or nay because it's their body. So I love that.
Absolutely.
That you do that. And so it kind of leads into my next question too of why is feeling safe or heard, in this case, a critical part of healing?
Listen, you can't heal if you don't feel safe. I think that's literally it right there. You can pretend to heal. You can put that smile on and pretend you're healing. But if you're with me, or I just use my clients as an example, if I'm with a client who's been sexually abused, or I'm with a client that got an injury, I'm working with that client in one of the most intimate ways that you can work with someone. Even when we're just doing exercises to strengthen, we're still working in intimate ways to where I hear about their life. I know what's going on with their spouses, with their babies, like what's going on. So I think like being able to truly heal, you have to feel safe physically, emotionally, mentally. It can't just be one of those. It has to be the whole thing.
For sure.
I think a lot of times, like, so if I think of pelvic floor therapy, that's again where I'm like, I don't target just what's going on. Yeah. I'm not going to target, oh, you have incontinence and do the cookie cutter thing for every single patient. That's not how it works with me, because why are you having incontinence? Did you fall and break your back a year ago?
Yeah.
Or are you so overwhelmed that you're holding your pee all day and then all of a sudden when you get home, you're peeing your pants? Like what is going on? And I think that's the big thing, like with anyone, especially with me, informed consent is my number one. When I'm doing an exam, the whole time I am with them, and I am very big on physical touch. It's a love language of mine, but it's in an informed way.
Yeah.
Like, so I'm a grounding person. So if I'm talking to someone, I will always say, I'm going to put my hand on your knee so we can talk, so they know where I'm at in space. To feel safe, you got to know where that person is too.
For sure. Yeah, no, that's really good. How does trauma, whether it's like birth trauma, medical trauma, or just life trauma, how does that really show up in the pelvic floor?
That is you have great questions. So a lot of women And you can do male pelvic floor as well. I just treat women, so I can't speak for the male population. But as women, we hold our stress and everything on our pelvis and our shoulders. So a lot of us are like this,
Yep.
and then we're like, oh, calm it down. It's going to be okay, girl. Same with our pelvis. So contrary to what people believe, you think, oh, I'm leaking, I'm weak. Oh my gosh. Typically, and not in all cases because everyone's different, but typically it's because we're like this. So if you think about it, you walk around and you were like this all day in our jaw. So our jaw and our pelvis are super connected. I'm just so focused that I'm like clenching. If we are like this all day and you cough, no wonder you're peeing your pants. If you were like this, and you're able to like work it, that's why we have to work on those like lengthening and strengthening techniques. So a lot of the time, again, if we're walking around super, super tight, that's a big red flag to me. I'm like, what's going on with you, girl? Like, what's happening? I can feel a lot of tension in the body. So when I do my assessment, I will start with just your body in the sense of you standing there, clothes, everything. And I'm looking at your shoulders. How are you standing? Are we hiked? What is our body doing? How are we breathing? Are we breathing just in our chest? Are we breathing in our belly? Like, it's a whole assessment of the body, and that tells me everything. I've had clients that have been so guarded, and guarded not from their exam pelvically, guarded everywhere to where I touch them and it's like, so if I'm working with someone and they're like this, I'm not going to touch their pelvis. What is that going to do to them? So that is where when I decided to go in my own private practice, because it's so hard in the insurance game of things and how like as a practitioner we have to follow like Medicare, Medicaid, all those rules. Private practice, I can do what I want because I'm cash pay, which is fantastic. But I also look at that patient, and if that is something they don't want me to do, I'm not doing it, because guess what? I don't need to touch you internally to tell you what we can work on.
Yeah.
We will work up to that. I'm also a big proponent, like a big supporter, of maybe we don't mesh. Let me find you someone that works for you.
Yeah.
Now, I mesh pretty good. People like me. I'm pretty outgoing and fun. But also, I'm not everyone's cup of tea either, because I am the way I am. So some people need someone that's more like A, B, like black and white. Let's get it done. I am like colorful. I'm like, okay, we have 20 ways to treat this one thing. What is the way that your body's going to respond the best to it?
That's really good. Yeah, and that's always my biggest thing too, is just because, even from a midwife standpoint or an OB or whatever, just because it worked for your sister doesn't mean that's what's best for you. And you should always vet anybody and everybody who you work with, not because you want to be controlling, but because it's important. And the fact that you are fine with maybe you guys aren't meshing well, but you're going to find them or recommend somebody. I think that speaks volumes to your integrity as well in your character, because that is what's going to obviously help the person.
I truly believe integrity is huge. And again, like around where we live, there are, I think, 3 of us that are pelvic floor therapists. Oh, wow. So there's someone for everybody.
Yeah.
Like there's someone that's going to fit for everybody. And again, I have a private clinic, so mine might be a little different. People might not have insurance, or they need to use insurance benefits. I know the other people in this area that are amazing and can really help. But I also think like there are not a lot of practitioners that are like that either. I want what's best for people. That's all that matters.
Yeah, especially at this point, especially if you're dealing with a lot of postpartum women, because postpartum can just be really tough, and they need somebody who's truly going to support them. I love that that's how you like view your practice. Kind of like moving forward with just like talking about the pelvic floor, because I feel like a lot of moms just, that's something that we don't actually get informed or get educated about in pregnancy and birth, and it's so important. But what is the biggest thing that women misunderstand about their pelvic floor?
That you just do Kegels and it'll fix everything. I'm going to tell you right now, that is not what fixes everything. I think any true like physical or occupational therapist that is trained in pelvic floor will like 100% agree with me. Like Kegels are not the answer. It is like the things our moms and our grandma, oh, just squeeze, you'll be okay. No. Because half the time you're already tight and like stressed. Why are we going to squeeze more and get it so hypertonic to where you're going to have incontinence? So that is probably the biggest misconception of all. And I like, if any other OTs or PTs out there, you want to fight me on that, I will go tooth and nail. But
Yeah.
no, I'm just kidding. But that I guarantee you can ask most therapists. They're going to say that's not the answer. There's a correct way to do them. And there's so many other things that you can do to help incorporate strengthening if you need strengthening.
Yeah.
So a lot of our postpartum patients, like, yes, they have anterior vaginal wall weakness, maybe because they just had a baby, but like I won't know until I assess them.
Yeah. No, that's really
So
good.
that's probably my biggest thing.
So then is leaking just normal after birth?
Oh no, girl, never normal. So right after birth, if you're having some leaking, it can happen, right?
Yeah.
We are, especially vaginal births, because everything just moved and everything's changing in there.
Yeah.
However, leaking is never normal. It's just, it's happening so much and it's trickling down to, I think of like our parents, grandparents, great grandparents who, that's normal, you had babies. I don't know. I met some women today who also said, they're like, oh yeah, I just pee and sneeze. And I'm like, oh, we can fix this. And it's typically a pretty, not an easy fix, but it's all about regulating our body and being able to get everything to work together again. So essentially when we're having like those leaking episodes,
Yeah.
it's we're having a stress response in our body that's causing our body to be like whoop instead of like working together.
Yeah.
So sorry that I have to do like the hand motions.
No, you're fine.
Because it makes sense. But
Yeah.
yeah, never normal. It's common, but it is not normal.
Gotcha. Yeah. So then what would be some of the key red flags postpartum that women should not ignore?
Okay. Big things. Any difficulty breathing. So breathing in general, I always teach and recommend doing diaphragmatic breathing to get things regulated. If you're having any issues postpartum postpartum with your breathing, go to the emergency room. We want to rule out any pulmonary embolisms, anything that might be going on, blood clots, those kinds of things.
Yeah.
Again, on the blood clot thing, so this is something I educate on. If we're having any warmth, redness, just pain in our legs, right to the emergency room. Let's see what else floor wise. If you are having like things we would talk about, like, I'm sorry, I'm going to say it, but like clots, like kind of coming out like thicker. I think they usually say bigger than like a coin piece, like really big, that needs to go to the emergency room. Postpartum with pelvic floor, right in the very beginning, it's going to be just any excruciating pelvic pain, making sure you're talking to your OB.
Yeah. No, that's really good too. When should a woman see a pelvic floor OT? Should they see him before birth, after birth, or both?
So in my opinion, I see women throughout the lifespan. So if we're doing this to be preventative and try to make sure birth goes well, I'll see women during pregnancy or even prior. So if they want to see me prior to kind of prep their body along with everything else they're doing, I'll see them during pregnancy and after. My favorite sweet spot that I've seen really good things happen would be like almost in that second to third trimester, seeing them pre, so I can really work on regulation. So when baby gets here, boom, they have time to start regulating their body. Around 2 to 3 weeks postpartum, I will usually call my clients, be like, hey, how are we doing? What's going on? Or I will visit them, do their blood pressure. So I know it sounds silly, but being able to have therapy within the first 6 weeks postpartum is huge.
Yeah.
So again, we've been postpartum. You go home and you have maybe 1 or 2 doctor's visits for your child.
Yeah. Yeah.
And then you get 1 for yourself, 1 or 2 for yourself. I mean, your child has more visits than you do, which it's crazy to me because you just birthed a whole human, but you go home and you're supposed to figure it out again. So one of the biggest research studies like I worked on and like what we were doing was, where are we filling this gap 0 to 6 weeks postpartum? If you do the research, it'll show you that I think it's 54% of maternal health women, like after birth, the ones that pass away are within those first 6 weeks. It's because no one's monitoring them. So around that 2 to 3 weeks, I will go see my patient. I will take blood pressure. I will work on breathing. I'm not doing anything internal at that point just because they have to really work on healing, right? And then around that 6 to 8 weeks postpartum, when they are cleared by their physician, I will start with pelvic floor therapy again. But I do work with them either virtually or in person postpartum just to make sure everything's okay.
That's good to know because for me, I just feel that women should be seeing a pelvic floor therapist, especially because a lot of the things that are deemed normal and you just have to live with and stuff can really change the quality of your life.
Yeah.
And even if you're still planning on having more children down the road too, it actually could help make your pregnancy, your birth, and that
Yeah.
postpartum just be a lot more enjoyable and stuff too. You had also mentioned to me just about lactation support. Can you kind of like just dive into that for us? I just feel like there's a lot of people that don't realize that OT can actually also support lactation. So, what does that look
Absolutely.
like?
Yeah. So, something I do from my
Yeah.
aspect when I work with moms, I will help them, if I'm at that visit, help them with like positioning. So, being able to help baby latch, get into positioning, those types of things under my license, it's a co occupation. Feeding is an occupation that we do.
Yeah.
So, it's something I do help with women. My team member, Olivia and Dana, they're my other part of my business. They are lactation specialists and soon to be IBCLC, which are the certified lactation consultants. One is a speech therapist, one is an occupational therapist. So we come from that vast background of therapy and being able to provide the lactation part of things
Yeah.
because at the end of the day, I think even my two journeys with my girls with nursing. My first, I exclusively pumped for a year, and that probably aided to my stress and anxiety
Yeah.
because if you didn't make enough the one day, those types of things. Where Georgia, my second, I literally just pop her on and she nurses beautifully.
Yeah.
So I think there is a huge misconception of what everyone's feeding should look like. I am pro let's make mama feel supported
Yeah.
in any way so we can, whether that be with positioning, with holding the bottle.
Yep.
I work on supportive mom, so how our body is. So if we're leaning back like this, we're probably not going to do a good feed.
Yeah.
So being able to show them how to support in the hospital or at their home, we work in the home. I work on that regard. But my partners do more of the bigger lactation stuff in the myofascial, like working with the mouth and the muscles. But definitely from the basic standpoint of being able to help with positioning and ergonomics, that's huge of what I do. That's
Yeah.
a lot of stuff what I do.
So you're really passionate about teaching women that they have autonomy. Why do you think that so many women don't feel like they do?
I feel like our health system trains us to just adhere to what we're supposed to be told by our doctors.
Yeah.
So I think of grandparents, right? Our grandparents, great grandparents, whatever the doctor said, that's what goes and that's what we do.
Yeah.
Now, I will say I'm not trained as a physician. I love physicians. I love the OBs I've worked with, but I also encourage people to question. I encourage people to question me because though I'm very educated, I don't know everything.
Yeah.
I'm learning something every day. So the best thing about autonomy is if you don't know the answer, like if you're like, Stacey, tell me about this. And I'm like, you know what? I don't know, but I will find that out for you and give you some evidence to back that up. That's what I'm going to do. I also think it's super important for women to be able to speak up because if I knew how to do that during my first birth, I could have walked away because I was not in a dire need to have an induction. And I truly believe that because after they're like, why did they do the induction? I'm like, I don't know. I was told I had to.
Yeah.
At that moment, I was like, I'm done. I'm done. Like, if this is how someone who, and I don't mean this to sound like rude, but has education in this whole realm felt, I can't imagine someone who doesn't have that background being pressured into that and maybe lost a baby or baby, like whatever it might be, or the trauma of going through something that you weren't prepared for. I think birth is one of those things we can't prepare for 100%.
Oh,
like,
for sure.
I was joking earlier when I threw my paper, but that's literally a birth plan to me.
Yeah.
And there's so many people that have had beautiful like plans, but I think also having an autonomy to say like, hey, I'm going to have my doula here with me. And instead of the healthcare professionals, some of them get really like uptight about that. Allow them to have their support system. Maybe they don't have a spouse.
Yeah.
Maybe they don't have their mom.
Yeah.
Allow those people to have a voice because they don't get to make all the decisions about their health, but they should have some say in it.
Absolutely. No, that's a big thing of just what this podcast is really about too, just empowering women to know that you have options no matter how you choose to birth. Like for me, I don't care how you birth. I just want you to be able to go into your birth feeling encouraged, feeling empowered because I don't believe that birth is meant to be traumatic in the aspect of when you're empowered and encouraged and you feel safe Birth can
Yeah.
be just so empowering. It's intense and
Yeah.
it's a lot, but
It's
so
so
empowering.
empowering.
It really
Yeah.
is. Okay, so now I want to play a little bit of a Mythbusters game here. So I'm going to say a phrase and then you can say myth, truth, or even partial truth if you want to. And then if you want to expand a little bit on it, you can. But the first one, leaking after having a baby is just normal.
Myth.
Okay. And if it's common, that doesn't necessarily mean normal, correct?
Right.
Okay.
Like it's common,
Yeah.
like it can happen, but that's not normal.
Yeah.
Yeah.
Perfect. Okay. Next one is if you had a C section, you do not need pelvic floor therapy.
Myth. I almost said false, but myth. You probably need it more than a vaginal birth. I mean, they both need it, but that's the biggest myth.
Yeah.
Yes.
Can you expand on that just a little bit for any of our C section moms that are listening?
For sure, absolutely. So, when you have a vaginal birth, baby pushes through the birthing canal, we're able to kind of move those tissues, baby comes out, we might have tearing.
Yeah.
That's going to be like my big focus with our vaginal births,
Gotcha.
amongst other stuff, prolapse, whatever. C-section births, everyone thinks, I got that baby cut out, nothing's wrong down there. False. You have 7 layers. You have 7 layers they cut through and sew each individual layer up. So not only are we working on our uterus contracting back down, not only are we working on our belly muscles to co-regulate again so we can have bowel movements and go to the bathroom, not only are we working on trying to go to the bathroom, we're working on that healing process is all 7 layers. So
Wow.
I think when it comes to that's the biggest thing I work on is going to be like mobility and motility of that muscle and those organs in that area. Also knowing that like when you're pregnant, everything's up here and it's shifting back down with gravity. So being able to work those things back down, it's like one of the biggest. I automatically should have OT, PT orders for pelvic floor therapy.
Wow. Yeah, that's really good. This one you kind of already touched on earlier, but I'm still going to ask it anyways. But Kegels
Okay.
fix everything.
Myth. Oh,
Extra
yeah, that's the biggest
myth.
myth.
Yeah.
Extra myth. Yes.
Okay, and then if you're young and healthy, you won't have pelvic floor issues.
Actually, that's partial, I would say. I want to say myth because I don't think it's hard. I don't want to say myth fully because not everyone has pelvic floor issues, but a lot of my clients that are young have pelvic floor. So I see a lot of athletes. I see a lot of college athletes. I see a lot of ballerinas. I see a lot of people who do Pilates, like all of the things where you're told to hold your core tight all the time. Those are the patients I'm seeing. I didn't even touch on the core with you guys. Pelvic floor is more than the pelvic floor. It is your core. So a lot of athletes, a lot of young, beautifully healthy runners are one of my biggest like clientele because runners hold, for the most part, I am not a runner. I wish I could be, but I am not. But I know how their bodies are. So a lot of runners are rib grippers. They're like their ribs will like expand in their grip. They would call them gripping, and they hold their belly so tight we have incontinence because they can't relax. A lot of those like leaking issues are because we are like this, like I told you, we can't relax our body down. So that's probably besides my postpartum perinatal are my athletes.
Yeah, that's what I was going to ask too, just because I feel like athletes would probably have a need for that.
And also I was just thinking about this, my power lifters, male and female. I don't see the males, but female power lifters and like I'm married a strength and conditioning coach. I am all for lifting.
Yeah.
Like I love it, but there's a way to regulate your breathing. So the ones that hold their breath while they're lifting all that weight and pee their pants, not normal.
Yeah.
But there's a couple, I've worked with people who do powerlifting or just heavy lifting, which I am a big advocate for. But also a way to train your breathing and how you're doing it so you don't have those pelvic floor issues.
Yeah, and that's good. I'm a big advocate too just for moving your body while pregnant, knowing how to breathe and how to support your core when you're lifting or exercising or whatever is definitely crucial. So I'm glad that you touched on that.
100%.
The
Yes.
last one that I have here is that painful sex after birth just takes time.
Myth.
Can
You
you,
should never have pain.
yeah, can you
Never.
expand on that a little bit? Just because, I just feel like we get into this mentality of, well, 6-week appointment, came, gone, everything should be back to normal. We should be able to have sex however, whenever, and everything should just
No
be
pain.
back to
Yeah.
normal.
Thank you for bringing this question up. This is a huge other part of what I educate on. So I always tell my patients when I meet them, I'll be like, hey, Brooke, I'm Stacey. Thank you for coming in today. We're going to talk about pee, poop, and sex because that's all I do all day. And they usually laugh at me.
Yeah.
So when we are having intercourse, whether it's pregnancy, postpartum, in that realm, we should never have pain with that. So let me back it up a little bit. When we have a baby and we have that baby and we're cleared at our 6-week appointment, 4-week, 8-week, whatever it might be, and the doctor's like, yep, everything's great. You can have sex again. You can exercise, yada, yada. What I typically recommend, if you are breastfeeding, if you are bottle feeding, lubrication is going to be your best friend.
Yeah.
Because when your hormones are like estrogen dominant, progesterone, whatever's going on, your oxytocin, like all the things that we do for lactation and prolactin and whatever, it can mess with all of our fluids in our body.
Yeah.
When you're breastfeeding or pumping, like you were outputting so much fluid that it can make things uncomfortable down there. Dryness can occur. Menopause is huge. So any of our women in perimenopause, like menopause, whatever it might be, using lubrications can be helpful. Another thing, after baby, we can have weakness in the sense of, so if you think of the vagina as a circle, it's not really, but if you think of it like that, you have 4 walls. You have your upper wall, your anterior, your posterior, and your lateral walls. So a lot of time after babies, when we're healing, right? So we just have that big old butterball on our belly and our bladder and all the things. Our bladder can be pushed on, which we know because we have to pee every 5 seconds.
Yeah.
Which can push down into the vagina, which can cause, there's many things. It can cause I usually say anterior wall weakness. As an OT, I cannot diagnose. I can't tell you have a prolapse because I'm not a medical doctor. However, when patients come to me and they're like, oh, I have a grade 2 vaginal prolapse, I'm like, okay, well, let's work on this. A lot of my moms will have weakness more than prolapse. So we're working on, that's when I know we got to work on strengthening in that realm. So those are like the big things that whenever I'm looking from that perspective, I want to see what's going on inside there. I've had a lot of women come to me because they're having pain on initial insertion. So this is super important to talk about. And I'm glad you brought this up because this is like, I would say half my caseload, especially with my postpartum women. You know, you haven't had sex for like maybe months at this point, or you're not comfortable. I think a huge other thing, nervous system regulation. I think of my own journey. Like I've been married to my husband for a long time. We've done a lot of things in a long time. But like even after this baby, I just wasn't ready at 6 weeks. My mental health, not mental, but my like everything wasn't ready. I felt yucky. I'm not showering. So I think if you're not in the zone there mentally, you need to have communication with your partner.
For sure.
And I think your partner as well needs to understand that they have to also take care of your emotional needs before your physical needs can be met and vice versa. I have a wonderful partner, so I didn't have that issue, but like also that can be why we're having pain. So I've worked with plenty of clients where they're coming to me, they're like, I'm 3-4 months postpartum, like this is hurting. I'm like so like this. I'm like, we got to work on your nervous system. So again, breathing, getting in the mindset, talking to your partner, that can really make things easier. Lubrication, don't be afraid if you're 22 and just had a baby. If you're 42 and just had a baby, it's going to make things so much better. Also, breathing while intercourse. So if we're having deep insertion pain, so like maybe you're like, it feels like something is getting hit. A lot of women will be like, it feels like something's like hitting me in there. Well, let's see what's going on. Because that could be something structural that's going on after that we might catch and go back to the doctor. But no, if you're having any pain, I mean, the first time if you're not using lubrication, it might be discomforting or just like awkward, but it should never be painful.
Yeah, and that's what I was going to say too, like the difference between a true like pain and discomfort. It's important to decipher the two because nothing should be feeling like sharp.
Or like if you have a woman who has like a vaginal birth and they might have had like a grade 2 or 3 tear, we might be hitting scar tissue. So that might be an area we're working through the scar tissue together, or I'm teaching you how to do that to empower you to be independent in that. Because my whole goal is for you not to see me 15 times. My whole goal, I would love to, but like my whole goal is to empower you and teach you to take care of what's going on so you don't have to see me for 15 years.
Yeah, no, that's really good. What is one thing that every postpartum mom deserves but rarely ever receives?
I think one thing, I mean, there's a million, right? But I think one of the things that moms should receive would be like acknowledgement, and not in the way of like you're doing a good job. Like if someone told me that postpartum, I'd be like, why are you telling me that? I'm a mom. Like I have to do this, right?
Yeah.
But acknowledgement that they are aware that they're like they have a community of people. Does that make sense? Like from that aspect, I think there's so much to postpartum. There's not even just what I do. I mean, everything we do. I think of when I was one of my only friends who had a baby. None of my friends had babies yet, except for like one or two of mine. I was one of my first friends to start that little funness. And you know, the friends at the time, they weren't doing it to be spiteful or anything, but they stopped inviting me to things. They're like, oh, we thought you wouldn't want to go because you have a baby. No, I want to go more and tell you no.
Yeah.
But I think like one of the things, and maybe that is probably my point, is women and moms and whoever, they want to feel included and supported.
Yeah.
But they won't ask you for that. And to be able to support them without them having to ask you means a lot.
Yeah. That's good. That's really good. So I like to end my show with one question, and that is, if you could speak one piece of empowering wisdom into the hearts of the mothers listening, what would that be?
I think what I would tell moms, don't settle, advocate for yourself. And if you feel like you cannot advocate, get that safe person that loves you enough to help you advocate. If you don't feel like you can make your decisions and utilize your own autonomy, have that person that can help you do that. Because there are some people out there, me, who I'm like, I will advocate for anyone, didn't know how to advocate 7 years ago for myself. I could advocate for my patients all day, but never for myself. And I didn't have that person for me. My husband was used to being married to a type A woman, and I needed someone so much more than I ever thought I did. And to know that women that are like me, that are very like outgoing and like seem like they have it all together, sometimes don't, and that's okay. And then the women that are quiet might have it all together, and that is okay too. So being able to advocate for you or have that safe person that can help you advocate.
Yeah, no, that is so powerful. For our listeners, if anybody is wanting to follow you or connect with you or maybe even use you as their pelvic floor occupational therapist, where can they find you?
That's a great question too. So I use my mommy and OT Instagram. So it's at mommy_and_OT. Connected to that is my business platform, so the Wildflower Wellness. And I see patients virtually all the time as well. That's a huge market that I'm in, that we can discuss and do things virtually too. But that's like the best place to reach me. I love like getting my follows so I can follow you back and share your beautiful things. I also have tons of wonderful people that I follow that I usually encourage my patients to go on my Instagrams and tell them, look at who I'm following and follow those people. They're going to teach you stuff that you need. I also, one little tidbit, I will say, watch who you follow on Instagram, because everyone thinks that they're something that they're not educated in.
Yeah.
So that's like my biggest thing that I do recommend, just really looking at the credentialing of who you're following.
For sure. No, I definitely agree with that. Stacey, thank you so much for coming on Her Birth, Her Story.
Thank you so much for having me, Brooke.
I'm so glad that Stacey was able to come on the podcast so that we all know and understand why pelvic floor therapy is so crucial, especially postpartum. I would have never known that Kegels don't actually fix everything. I feel like that's always everybody's answer is, oh, well, make sure you're doing your Kegels, make sure you're doing your Kegels. So it's great that she was able to explain to us why that's a myth. And I really think that this conversation helps us as women to understand the importance of pelvic floor therapy, but also to advocate for ourselves and to take care of ourselves. So if you are wanting to work with Stacey or her team, virtually or in person, make sure that you follow her Instagram accounts and reach out to her, because obviously she has a lot of really good information on social media as well. If this episode encouraged you, please share it with another mama who needs to hear it, or that has been asking questions about pelvic floor therapy if it's something that she should do. Please don't forget to like, share, subscribe, or rate this show because it is the best way that we are able to reach more moms. And don't forget that this is your body, your baby, and your birth. We are reclaiming birth one story at a time.